Doctors who have given a second opinion diagnosis. What is the worst first opinion you've ever encountered? Well, when I first started feeling sick the October of 1 year at college, I had a non-productive cough, night sweats and trouble sleeping, and I had lost some weight. The school nurse gave me Claritin. All of those symptoms got worse. Plus I was incredibly fatigued, my lymph nodes swelled up, and I had pretty bad backaches. My GP took a chest x-ray and prescribed antibiotics for pneumonia. At this point I had almost failed out of school because I was only managing an hour or two of sleep per night. It took until spring break for me to go see a pulmonary specialist. He could instantly tell that it wasn't pneumonia. I had stage 4B Hodgkin's lymphoma. My first PET scan showed cancerous cells and lymph nodes in all 4 quadrants of my body. At this point I had lost about a third of my body weight. The cough, weight loss, and back pain were my swollen lymph nodes pressing on my lungs, stomach, and my back. They gave me my first round of chemo and I genuinely felt incredible. I felt like such crap that an IV mixture of carefully measured toxins was an improvement. I went home and ate a whole pizza. Chemo got shittier but it worked, so I guess I can't complain too much. Glad you're okay. What a horribly frightening experience that must have been. Stay with us, friend. Not me but my mom. She was always exhausted, the type of exhaustion that she'd have a bath, be so tired from it, she'd sleep on the bath mat when she got out. Went to her doctor, told her, "Oh, you're just depressed. Go get a haircut." She did. Still exhausted. Went back to the doctor. Continued to tell her she's just depressed. Get a hobby. It's all in her head, etc. Never send her for blood work. Never referred her to any specialist. Months later she goes back. Her doctor is on vacation. Physician reliving her doctor takes one look at her eyes and says, "It's your liver. Get these blood tests now." Abnormal blood work and a liver biopsy later. She was told she had autoimmune hepatitis and was 3 months from death. After she improved with medications, she went back to the original doctor and said, "I didn't need a haircut." 27 years later she still suffers from lingering effects. I'm a surgeon. Most patients come to me after having seen another physician who has diagnosed them with something and told the patients to see a surgeon. I've been called to see more than one patient for appendicitis who has already had an appendectomy. I've also been called in multiple cases for patients who very obviously have previously undiscovered, very advanced cancer. It always too far advanced for me to be of help, so I have to wonder, am I being called so I can be the bad guy and explain everything? Yes, the answer is yes. I have one that happened to me. I did college gymnastics. My senior year I had an accident in practice landing in my neck. Went to the hospital, got x-rays, was told I was perfectly fine. Walked around in pain for a while. Weeks later went to another doc, got a new set of images. My neck was broken in 3 places and had a dislocation. Had a multi-level fusion surgery days later. Found out my X-days got swapped with someone else's in the year and I was originally diagnosed based on someone else's images. This was found out when I went to get my records long after my surgery for insurance purposes and my files had someone else's medical records and images in it. Because of the time I spent walking around with it I had to have a posterior surgery instead of anterior, which is way more invasive and gives me major issues to this day. I'm a lawyer, but had a client given a devastating diagnosis of an extremely rare heart condition. Doctor told him he had 6 weeks to live. He contacted me to make his will and set his affairs in order. Thankfully, he sought a second opinion with an extremely well-known cardiologist. I guess the cardiologist was intrigued due to the rare nature of this heart condition. There was nothing wrong with him. He was fine. This poor guy and his family were tortured over this, so devastated and terrified. For nothing. He actually called me to tell me all of this. He seemed to be still in the joyous "I'm not going to die" stage. But I imagine anger comes at some point when you take stock of what you went through. I don't know how a doctor fricks up that massively, or if somehow my client's results were mixed up with someone else's, and some poor bastard's number is almost up and they don't even know it. Not a doctor. My sister was about 2 weeks away from giving birth when she suddenly started feeling excruciating pain and vomiting. I called her midwife, who refused to speak with me despite my sister clearly not capable of speaking, as she sat on the floor next to the toilet, crying and puking. Finally she just took the phone and was told by her midwife that it was probably just a virus and to eat a popsicle. Eventually I was able to convince her to go to the ER. She was immediately rushed in the OR for an emergency C-section. Her placenta had abrupted and my niece was born not breathing, suffered several seizures and even died, and then was resuscitated. She is now 15 and has cerebral palsy due to going so long without the oxygen she needed. Patient. When I was in college I went to the doctor because I was P-raises. It progressed pretty rapidly and by the end of the week I couldn't walk or sleep. The doc asked me about my sex life and I told him the truth, that my girlfriend and I had only been with each other and together for many years. He sorta scoffed at that and told me it was likely chlamydia. Had a long condescending speech about safe sex with me and sent me home. A week later my P tests were back. Turns out I had the worst bladder infection they'd ever seen. I had to have a camera shoved up my pee hole, multiple rounds of antibiotics, and to this day I struggle to pee due to irreversible damage the infection caused. Oh man, that sucks. UTIs are rare in men but super common for women, and I get like one every other year. I've gotten really good at feeling the beginning of one before it gets worse, and I drop everything and rush to urgent care. They hurt. This is the opposite answer, but the best request for a second opinion came from a CVS Minutes clinic. Young healthy law student goes to Minutes clinic. Has the flu. This was a few years ago. No Rona. Feels awful. They check him out. Yup, he has a fever, aches, sore throat. It's the flu. Flu swab positive. His clinic vitals were notable for a heart rate of 140. A bit high but not crazy high. Reassuring numbers. 100. The guy otherwise walked into the CVS and is a young healthy guy. Would have been pretty easy to dismiss. Anyway, the Minute clinic says go to the ER. You need an EKG. So the guy follows orders. A chief complaint is I have the flu and CVS told me to come here. Gets an EKG and he's in slow VT, which is a life-threatening arrhythmia that you have to be shocked out of. They take a look at his heart and it was giant and barely moving. He had an insane myocarditis. Dude ended up getting cannulated for ECMO within hours. Cardiac bypass machines as life support. I can't say all Minute clinics are the same, but holy crap, that was a great save. I'm a gynecologist. The number of times I've seen patients pregnant and upset, or happy, because some other doctor told them they can't get pregnant, so they didn't use birth control, is appalling. Usually it's family med, not ragging on all FM docs, just how it goes. I then have to explain that even if the patient has whatever condition that makes it unlikely for them to get pregnant, the odds are almost never 0%. Maybe 1%, but still not 0. So of course it can happen. Not a doctor, but my mom went into a walk-in clinic and told the doc she had really bad headaches all the time. She was a stay-at-home mom to me, 10, and my sister, 6. So it was written off as stress and got a prescription for pain pills. 2 weeks later the headaches were migraines. Stronger prescription and try to reduce stress. A few weeks go by and she can no longer get out of bed. Throws everything up including the meds, is completely disoriented and barely alive. My dad was a truck driver so he was never home. I was taking care of me, my sister, and my mom all by myself. We go back to the doctor and this lady had the audacity to say this is the weirdest migraine case she's ever seen. Tells her to take warm baths and just keep taking the meds when she throws them up. 2 months go by and my dad came home, saw the condition of my mother, who was so sick she would urinate herself, the house, which was being kept up by a 10-year-old, and said he wanted a divorce. That night we found out she had stage 4 lung and brain cancer with a tumor the size of an egg pressing on her brain as well as many others scattered throughout. I still haven't forgiven that doctor for not taking my mom seriously. I just left a practice partly because a woman brought her 8-month-old in for a second opinion. The practice owner had seen the rapidly enlarging sacral soft tissue mass which the mother first noticed about 6 weeks prior. He told her not to worry about it. I checked his notes, which read, plan, ignore. I was shocked. There was a new onset rapidly enlarging blue purple cystic mass on a baby's sacrum. It looked like a small plum under the skin at the top of her bum crack. and without any investigation my colleague dismissed it. I was appalled. The mother was relieved. This wasn't the first not great judgment I'd seen, but it was one of the worst. I realized I couldn't work in a clinic where I'd be stepping on other doctors' toes and couldn't trust their judgment. The babies had a imaging and a referral to a pediatric surgeon, but unfortunately I don't know the outcome because I'm working elsewhere now. Honestly, at that point I'd pull the mother aside in the lobby and say something like, if it doesn't improve on its own in a few days, I'd find a bigger place to give you a third opinion. Told by my doctor my health issues were stress related. The second opinion found my gallbladder was functioning at 3% and had that sucker removed a couple weeks later. What's worse is I specifically asked the first doctor about gallbladder and they assured me it couldn't be that. Gallbladders are notorious for causing a ton of seemingly unrelated health issues. After mine was removed, my life improved dramatically. Not a doctor. My husband had a situation where he almost died because of a misdiagnosis. To preface this, at the time we were young in our mid-20s living in a college town. My husband had horrible pain. On floor, on hands and knees, horrible. We went to the ER and the doctor barely looked at him and just told him to stop drinking and he would be fine. We go home, the pain is getting worse and now he is vomiting. As soon as the doctor's off opens back home where we grew up, we drove 1.5 hours to see our primary care. Within 15 minutes of walking into the GP office, my husband was rushed to emergency surgery. His gallbladder had completely ruptured and he was going septic. It was a total mess and he almost died, all because of a misdiagnosis. Not a doctor. Dealt with an unrelated incident and reading a patient's notes found he had been diagnosed with a rare but deadly skin cancer and was booked in to have his upper lip removed. Obviously this would leave the patient quite disfigured. On a whim he'd booked in to see a dermatologist at our hospital, who advised it was a cold sore, prescribed Acyclovir and the problem was resolved. This one astounds me, not only because I'm pretty sure doctors are told not to expect a zebra when they hear hoofbeats, but also because you'd think they would have run a simple test before major surgery. I went to a walk-in clinic because I couldn't swallow anything. The doctor pressed on my forehead and asked if it hurt. I guessed kind of. He told me I had a sinus infection and prescribed me antibiotics that I couldn't swallow and sent me on my way. Turns out I had had a stroke and ended up spending 3 weeks in the hospital. This is the one that really made my eyes bulge. Hope you're well these days. Not a doctor. This happened to my mom like 20 years ago. I believe she was close to 36 at the time and had 6 kids. My mom was having severe abdominal pain, and if my mom admits to being in pain then you know it's bad. Her family doctor was on vacation and so my dad took her to Emerg. Emerg doc told her she was constipated and sent her home. The pain got worse and so she went back to Emerg a couple days later. She specifically asked the doctor, the same one from the previous time, if it could be an ectopic pregnancy. He laughed at her and sent her home. She ended up in Emerg a 3rd time and got that same stupid doctor who accused her of lying to get drugs. She had to wait a week until her family doctor came back. Just over the phone the family doctor could tell something was wrong and told my mom that she wanted to see her first thing in the morning for tests. Mom didn't make that appointment because during the night her fallopian tube ruptured and my dad found her unconscious on the floor downstairs. He rushed her to the hospital and they found out that she was something like 10 weeks along with an ectopic pregnancy. Our family doctor apparently was screaming at the other doctor in the hallway because of his incompetence. Not a doctor, but I went to a dermatologist for a rash on my hands and face. He insisted it was eczema even though I've never had eczema in my life. He refused to do any testing or take a biopsy. He prescribed me a steroid cream for eczema. The rash spread and got horribly worse. It was all up my arms and all over my face. It was itchy and painful. I went to a different dermatologist and explained the situation. They took a biopsy. It was a bacterial infection and the first doctor essentially gave me a bacterial infection on steroids. I was a minor at the time and I don't know why my parents didn't go after the first doctor. I am late, so this may not get seen, but it's a good story. Not a doctor. My grandmother fell from her horse one day. Not a terrible fall, but from the way she landed, she wanted to get checked out. She felt she'd really jolted her neck spine, and was an older lady with fragile bones. Her doctor looked things over, gave her one of those soft neck cushion things and sent her home. A couple days later, she decided to get a second opinion. No real reason. She just hadn't felt listened to by the first guy. The second doctor basically took one look at her x-rays and freaked out. He told her they needed to get her immediately into a brace to immobilize her spine. I googled to try to figure out what it was. I think it is a halo brace, but in my memory it's bigger and more metal than what I was seeing in the pictures. Basically she'd broken her neck, the same injury that had paralyzed Christopher Reeve, but she wasn't paralyzed because the vertebrae hadn't dislocated. The second doctor anything that did dislocate it, another minor fall, twisting wrong in bed, would mean being permanently paralyzed from the neck down. She wore her intense metal brace that kept her spine in place for a few months and was totally fine. She lived another 15 years after that. But I think about that story often. The second doctor saved her mobility and freedom. Obligatory. I am not the doctor but I'm the patient. I went to a sleep doctor because I was constantly tired and falling asleep standing up and such. Serious crap. Doctor was like, well, you're overweight, so it's definitely sleep apnea. I did a sleep study, came back negative for sleep apnea. Doctor was like, well, I'm still positive it's sleep apnea, cause you're a fatty. So he sent me home with a CPAP machine for a month. After a month of using the machine, which records your sleep apnea events every night, and still said I didn't have sleep apnea, and with me having zero improvement in any of my symptoms, I went back to him and he said, well, if this isn't working, I can't help you, because you obviously have sleep apnea since all tubbers have sleep apnea, so you must not be using the CPAP. So I dropped him like a fresh turf and went to get a second opinion. New sleep doc, new sleep study. Come back in and the new doctor's like, yeah, this is textbook narcolepsy. You have all the symptoms and the sleep study proves it beyond a shadow of a doubt. I told him about the other doctor and he said, this is obviously narcolepsy. Your previous doctor was a moron. And, unlike the other quotes in this story, that is an actual, direct quote. I'll never forget the look of disgust on his face when he said the word moron. Also not a doctor. I was diagnosed with MS, sought out a second opinion, and turns out it was an easily solvable vitamin deficiency. Pretty dang different. $15,000 in medical bills later, only go have all symptoms subside with some nutritional advice and supplements. I'm still salty about it. I had a period of about a year where I was getting constant UTIs, which, apparently, as a woman in her mid-20s is normally caused by not peeing after sex. I'm still not sure what was causing mine, but I was not sexually active at all, due to vaginismus. My doctor was away for school holidays and stupidly, I thought I could last a week until she was back. Nope. 2 days later, I could barely move from the couch in pain. So, I called the doctor. This doctor, a home doctor cause it was a public holiday, refused to hand over the script until I acknowledged that I was being sexually irresponsible. When I said I am a virgin, embarrassing and potentially dangerous statement to make with a strange man in my house while I was home alone, this jackass laughed his butt off and said, no you're not. Nobody is at this age. Stop pretending to be all innocent. Slammed the prescription on my coffee table and walked out, refusing to give me the starter dose that they're required to carry. For people like me, who are alone and can't get the prescription until the first dose kicks in enough to begin helping. Full stop. I called the office to complain and he did get reprimanded, but holy heck was I embarrassed. Not a doctor, but my sister was suffering from headaches and minor seizures for a while. Went to an urgent care and that told us she had an anxiety disorder and just needed something to calm her down. We got a second opinion at the ER and turns out she had stage 4 brain cancer. I miss her every day. Posted about this before but I'll post it again anyway. This is my mom's story, not mine. So my mom used to work at a non-profit clinic that would give free healthcare to people who didn't have insurance. This guy came in with his teenage daughter, basically saying he was between jobs and the insurance for his new job hadn't kicked in yet, but his daughter was having her yearly case of pneumonia and just wanted her antibiotics. He was really arrogant and rude, saying stuff like, she has a Cuban doctor she usually goes to. My mom is Mexican and I live in an area where most Latinos you see are Mexican. My mom, staying calm despite wanting to bite the guy's head off, examined his daughter. She noticed his daughter's fingers were clubbed. Google clubbed versus normal fingers, and this was indicative of a serious, chronic respiratory issue, not something temporary like pneumonia. She asked if she could run a few tests just to be safe, and at first he was huffy about it but was persuaded when my mom told him it wouldn't cost him anything but a bit of time. A few days later, the clinic calls her freaking out because this girl didn't have pneumonia. She had cystic fibrosis. The girl was transferred to a hospital where she could actually start receiving treatment for her condition. It was a minor case. If it was anything more, she honestly could have been dead by that point. But my mom probably prolonged this girl's life expectancy with the diagnosis. Her regular Cuban doctor had been regularly misdiagnosing her with vitamin deficiencies and pneumonia. Later, the father called my mother and thanked her for helping his daughter. My mom was going off in her head. What about her Cuban doctor, how a-hole? But was polite and wished him and his daughter well. TLDR. Not really a second opinion. But when a Cuban guy who was arrogant about being Cuban came in with his daughter thinking she had pneumonia, something she was diagnosed with yearly by her Cuban doctor, my Mexican mother diagnosed her with cystic fibrosis and helped extend her life expectancy. Nurse here. I cared for a woman who had been diagnosed with broken vertebrae. She was in a lot of pain, couldn't get her pain under control, and her blood pressure was very low. She'd lose consciousness and be very difficult to wake. I also couldn't get her doctor to answer the phone, middle of the night. Something just felt off about the whole situation. He finally answered and demanded we Narcan her, insisting we'd overdosed her on narcotics. Following his orders, I then had a hysterical woman in a lot of pain going in and out of consciousness. I finally walked down to the entrance of the hospital and grabbed the cardiologist who came in at 4:30 AM for rounds and said, "This isn't your patient, but I think she's going to die." He came upstairs with me, looked at her and her chart, grabbed the bed and rolled her to ICU himself. I have no idea how the conversation went between the cardiologist and her doctor. She didn't have a broken back. She had an aortic aneurysm, which caused the pain and the low pressure, and the loss of consciousness. She died the next day. Doctors, if the nurse says something is wrong, you might want to lay your eyes on the patient rather than shouting orders through the phone. OMG, that is heartbreaking. Obligatory. I'm not a doctor, but when I had my wisdom teeth out, it was pretty brutal. Like they had to completely put me under, dig deep into my jawbone. The teeth were coming in sideways and upside down, just like the worst case scenario. So, I have the surgery in the next couple of days. I'm in a lot of pain, which happens, and I realize I have this growing hot lump on the side of my jawbone. Me being a dumbass, I tried to be like, oh, it'll go away, but it didn't, and my mom caught sight of it and took me back to the guy who did my surgery. Dentist dude took an x-ray and without even examining it or asking any questions said I was fine and it was probably just scar tissue and told me to leave. I thought, hey, well, he's smarter than me, so I guess he's right. My mother, however, did not think this. And so off we go for a second opinion, and while we're headed over to the other office, the hard lump in my jaw bursts and blood and pus leaks everywhere in my mouth. It was so freaking gross. My mom immediately turned around, drove back to the dental surgeon, dragged me, who was still spitting blood and pus, barged into the office, and made the dental surgeon look in my mouth. The dental surgeon muttered something about hysterical women seeing things that weren't there but prescribed me antibiotics and more pain meds anyway. And that was how the 1-2 week recovery took an entire month, and I ended up having to drop out of a college course due to missing so much. The dental surgeon muttered something about hysterical women. I'm pretty sure this fuckery has caused many deaths. Like many, not a doctor but just screwed over by many. Got an infected hangnail, so I went to urgent care. I got a shot of an antibiotic or a prescription for another. Took the pill for about a week out of the 10-day dose. On that 7-day mark I was in my chemistry class, which was at the end of the day, feeling extremely lightheaded, tired, and so dizzy I could barely see. I staggered down the stairs of my HS to see the nurse, but she was out to lunch. I didn't know what to do and had bad attendance due to chronic illness, so I stayed for the next class. Went home on the bus and passed out on my couch. For the next 2 days I had a bunch of symptoms. I spiked a fever of 104 degrees Fahrenheit, had a swollen lumpy throat, in and out of consciousness, vomiting, coughing, and dizziness so bad I couldn't stand. Went in the next night after coming home from school with a fever of 104. Urgent care doctor said that wasn't a treatable fever, that I had a upper respiratory virus that was also untreatable, and told me to go home and not worry. I wasn't allergic to the antibiotic I was taking because I was taking it for a week and had no reaction before that day. Next night felt even worse. Couldn't keep food down. Could barely breathe. Dizziness was so bad I couldn't get up to use the bathroom without being in severe danger of falling. There was also a rash that was going from behind my ears down to my stomach and little red blotches. Went to the ER this time. Also had a yeast infection from the med. Doctor there wouldn't touch me. He barely wanted to look at me. He wouldn't do any kind of exam on me besides look at the rash on my stomach. He said it was measles. Gave me nothing for that. Said there was no way I was allergic to the antibiotic. Sent me home. Went the next day to see my primary doc who squeezed me in due to my symptoms. Talked to the assistant getting my vitals and symptoms about what was going on. She said I was allergic to the antibiotic. She wrote in my chart that I wasn't supposed to take it. A nurse practitioner came in and listened to me tale of woe. He said I was having a bad reaction and also wrote again that I should stay away from the antibiotic. He said I could have died and usually would have because it built up in my system and caused a deadly reaction. Doc comes in and says the same thing. If I take it again I'll probably die. Not measles. Not an untreatable upper respiratory virus. My dad has a lesion on his leg that wasn't healing. The dermatologist prescribed different antibiotics, pills and ointment, but nothing was working. He did 2 skin grafts that didn't work. This went on for at least 2 years. Then my dad got a new dermatologist from the same hospital. She realized that he never had a biopsy. It took her less than an hour to diagnose the skin cancer. The surgeon scooped all the cancer out, another skin graft, and that was it for a while. Since then he got a lot of other skin cancer lesions but now he knows what it is. Not a doctor but a patient. When I was in labor with my 4th child the doctor refused to admit me. I wasn't very dilated and have a history of fast labors. I know when I'm in labor because the pain is different. He gave me a sleeping pill to take and told me to go home and sleep. I refused to leave. The doctor was angry and said he'd admit me, but wouldn't give me anything to augment my labor. My son was born 2 hours later. Frick you doctor. Listen to moms, we know our bodies. I had the opposite. I'm a midwife and gave a second opinion. The first was received from the woman's GP. She came into the antenatal clinic and said that she'd had a headache that she couldn't seem to shake. She'd called her GP the day before who had told her to take 2 Panadol and have a bath and that she'd be fine. Whenever any pregnant woman complains of a headache, especially one that won't go away, it sends alarm bells ringing as it can be a symptom of pre-eclampsia. Sure enough, the woman also reported seeing blue spots, had a blood pressure of 220/180 and a huge amount of protein in her urine. I got her to lie on her side in the room I was seeing her in, and raced to get a more senior midwife. It wouldn't have been more than 60 seconds that the 2 of us returned to the room, just in time to see her start having an eclamptic seizure. We called a code pink, obstetric emergency, which then escalated to a code green, alerting theatre that we were coming down now for an emergency cesarean, and the woman gave birth under general anesthetic 20 minutes later. I still start sweating when I imagine what could have happened if she hadn't come into the clinic that day. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video. Bye for now.